Hello friends, good morning. Today my topic is cervical spondylosis. Do you know that every vehicle has a wear and tear? The tire gets worn off as well as the brake pads, everything. Similarly, in our body we have so many organs to be, in the process of wearing of phenomena. Like you can have the joints, the spine, the vertebrae, as well as the heart, kidney, lungs, brain. Everything is prone for the wear and tear phenomena. If the wear and tear phenomenon occurs in the spine, you call it as spondylosis. In the joints, you got osteoarthrosis in the hip and other joints, hip joint, shoulder, like that. So today my area of interest is the cervical region. That is a cervical spondylosis. So this is a degenerative disease of the spine. The most common location of this degeneration is C5-6 followed by C6-7 and C4-5. I'll show you all this in this X-ray and this scan. Okay. So, what are the symptoms of cervical spondylosis? There will be pain and stiffness of the neck. That is the most common symptom. Similarly, if there are so many nerve roots arising from the foramen between the disc and the vertebra. So this gets trapped someday because there will be this degenerative process causes a new bone formation, something called osteophytes. This impinges or encroaches on the nerve roots, causing a radicular pain or sensory symptoms or weakness. This is called radiculopathy. Sometimes the process will go on until the cervical canal gets stenosed, it means get narrowed, and the spinal cord, usually it will be in a free fluid. There will be a spinal fluid around it. This gets compressed, and finally the the spinal cord gets compressed, causing a myelopathy. The symptoms of myelopathy are you'll get a stiffness, dragging of limbs, weakness of both the feet, hands, with the wasting, so thinning of the muscle here, as well as sensorism like paresthesia of the feet and hands, as well as you get some sensation, as though somebody is holding you tight, something like a girdle sensation. And when it's a cough or strain, the pain gets worse in the distribution of the nerve roots, as well as when you flex the neck, you get some sensory electric shock-like sensation called a limit sign. Sometimes there can be bladder involvement depending on the severity of the involvement. So as I mentioned, this is quite common. The spondylosis is quite common, but the complication related to spondylosis is not that common. So the spondylosis just degeneration. This can occur even up to the age of 30 years. So before 40 is said to be common in 25% of the people. And by 50 years it is common in 40 to 50%. By 65%, it's by 60 years is seen in around 85% of all individuals, whether it's a male or female. This is especially common in people who used to carry loads on their head, or in their shoulders, and those who dance, those who are gymnasts, sports people, soccer and various other sports. This is quite common, and especially common in those people with rheumatoid problem like rheumatoid arthritis, ankylosing spondylitis, some sort of cerebral palsy called dystonik cerebral palsy. And in these people with dystonik cerebral palsy, you get this sort of early degenerative disease of this cervical spine. So as I mentioned, there can be pain here, there can be numbness and pain in the distribution of the various roots. Suppose a C6 root, you get sensory symptoms in the thumb. C7 you get in the index and the middle finger. C8 root you get sensory symptoms in the little finger. And then there will be associated, if the spinal cord is affected, you get something like a limit sign, weakness, wasting, sensory symptoms, motor symptom, bladder symptoms, depending on the level, depending on the root or the part of the level of the spinal cord getting affected. So what are the various investigations? The investigations are the X-ray. X-ray will show the degenerative changes, the spasm, the loss of cervical lordosis, as well as various degenerative, the loss of the joint space, as well as osteophytes, or thickening of the anterior posterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum calcification, or the spinal canal stenosis. Okay. Then the next investigation would be MRI. MRI will show exquisitively the various changes, the disc bulges, disc degeneration, the desiccation, the spinal canal, as well as the root impingement, as well as the evidence of spinal cord lesion or spinal cord damage, myelomalacia, contusion. Everything can be very beautifully picked up in the MRI. But the problem with MRI is so sensitive that everything will be picked up. So you might think that, oh, everything related to this report is, you have everything. It's not like that, because MRI is so sensitive that it picks up everything. This need not be manifested in the patient. So the patient, you treat the patient depending on his physical finding, on his history, not based on a X-ray or MRI. All right. Then once you find that there is a problem like a cervical spondylosis, then the treatment would be depending on the intensity of symptom, whether he has got pain, whether he has got a motor weakness, sensory loss, bladder problem, or a difficulty in ambulation. So everything related to neck pain need not be cervical spondylosis. There is a condition called fibromyalgia or pain syndrome. That they can also present with the pain here and there in the shoulder, the neck, and the posterior part of the scalp. So you have to take a good history and find out whether it's a part of a fibromyalgia or pain syndrome, because if you do some surgery, this wouldn't be benefited. Secondly, if the person is complaining of pain on the neck and shoulder when walking uphill, should always consider the possibility of a angina or a problem related to the heart. Thirdly, there are problems in the spine, various problems in the spine like degenerative disease, the gout, Paget's tumors, and the craniovertebral junction anomalies, problem in the spinal cord, problem in the fistulas and the arteriovenous fistulas, spinal cord demyelination, tumors. So everything you have to take into account. And similarly, if somebody comes with a difficulty in walking, wasting, and weakness, always rule out the possibility of a motor neuron disease, because I've seen quite a sizable number of people getting operated with the presumption that because the MRI will show the degenerative changes and he will have some pain here as well as some weakness and wasting. So motor neuron disease has to be looked into, because you might find 1 or 2 in 100. So always be wary of this condition. Similarly, craniovertebral junction anomalies, they can present with this sort of pain, they'll call cervical nuchal pain. Some dystonia can also present with pain. All this sort of neck pain may not be due to spondylosis. There are some certain neurological conditions called cervical dystonia or torticollis that can also present with the neck pain, and they used to come with a collar. All right. So the treatment would be, once you find out the history, examination, X-ray or MRI, this is that the particular patient has a cervical spondylosis, then the treatment is you bed rest. That is the first and the foremost. 4 to 6 weeks are absolute bed rest. And when the patient gets up, he has to wear a collar, preferably a hard adjustable cervical collar. Then you have to give simple and don't give a higher end analgesic. Simple analgesics, drugs like neuropathic pain, drugs which would be beneficial for neuropathic pain you can use. So intermittent cervical traction, and if it's not working, then we have to admit the patient, do a cervical traction, epidural steroids, and other medication. If the patient is not better with these conservative measures, then of course you have to go further. Like you have to look into whether he would be benefited by a surgery. Surgery may be anterior or posterior, many approaches are there. This will be done by the neurosurgeon or the spinal surgeon. And after the acute phase, after the acute maybe 4 to 6 weeks later, then we can do the physical therapy, various rehabilitation, cold and TENS, and many things are available. So physical therapy is important, bed rest is important, and the essential medication, and including cervical traction and epidural steroids. I find that epidural steroids extremely useful along with the cervical traction. So that's in short regarding cervical spondylosis. And there is one more condition that because there are some people with congenital small canals, and they are prone for spinal cord damage once they fall. Then it's called central cord syndrome. It's also quite common, especially if the person comes to you after a fall with weakness of both upper limbs and lower limbs, and quadriplegia or quadriparesis. So that's also common, especially in people with a small congenital narrow canal. So you have to consider that thing also into consideration. So I hope this video is useful for most of you, and if you have got any comments or questions, you can always put in the chat box. Thank you very much. Bye.